I would like to introduce everybody to today's speaker, Mary Kay Chess. She is the Director of Educational Programs at NCHN, as well as the Dean of Academic Affairs at Pinchot University in Seattle, Washington. She also consults with foundations and organizations, as well as their boards, on building leadership capacity. So I will turn it over to Mary Kay to share her presentation today.
Leslie, thank you, and welcome everyone. Before we leave this survey, let's take a quick look at the two questions and see how the responses have lined up. Everyone landed on the key element of communication to build trust and collaboration, and how that contributes to sustainability is well documented. And it sounds like you've each experienced that, so there's some real total agreement around that question. What's interesting in the second question is that, and this may tie to how seasoned your network is, that 5 of you responded that a key document for your network is the number and names of key stakeholders. That's certainly so essential in communication if you're going to engage board members in calling key stakeholders. So well done. 5 of you have landed on that. This also facilitates the second item that some of you selected, that board member communication, how often board members are communicating to external communication, is something that you like to track in your board meetings. That really also contributes directly to sustainability. And certainly the third one that you selected, actually reporting on who and how many folks have attended each board meeting or subcommittee meeting, is another critical element of sustainability. So thank you. You can begin to see that not only are you from all over the United States in this conversation, but what's working in your network, your unique network, is also different. Great. So Leslie, I think we're ready for the slides. And while we're pulling those up, if each of you would also pull up your assessment tool, this is probably the most dense section of the assessment tool, so we'll be posing a lot of questions and moving along. But I would also encourage you, because this is a learning community, to at any point use the chat box or *2 and pose a really great tool that you found to be successful, or ask us to pause and be in conversation. This is, after all, about communication, so let's make use of the subject and kind of engage in the learning that goes along with communication. So before we actually dive into your survey and getting this last section done, could you join me in the chat box and put into the chat box what you believe are key features of sound communication? If you think of your board and really sound or stellar communication, what are key features of sound communication? Just go ahead and type them in the chat box. We're going to have you do some multitasking here today. Warm up those fingers and kind of get moving. So into the chat box if you don't mind. There we go. Thank you. And because Leslie's recording this particular segment, I'm going to read a couple of these out, not all of them. So as best practices emerge, please take note of them. They may inform your network and your network board. So here are some features that are emerging for communication that allows most likely sustainability of networks or any relationship to thrive. Communication that's transparent. Gail, that's so important, because as we have looked at the very definition of a network, often it is competitors coming together to collaborate on areas that really serve a greater population. So that transparency of when you might be in conflict or when you might be in competition is so important. Good listening, positive and concise comments, so important. Open and bringing new information, I imagine, Suzanne, is another point of being open. So thank you for putting in these elements of communication. Let's continue to unpack these as we go through. You know, before we dive into this actual assessment, assessment, just a really quick definition of communication. And if we think about it as a flow between you, the network leader or executive, and your board or your steering committee, it's a two-way conversation that allows for communication to take place. As many of you have identified here, if there's transparency, good listening, and reflecting back, it means that you're building understanding and that you're able to unlock innovation and creativity, as we talked about in the first time we gathered together. And the outcome of great communication or effective communication is that it facilitates, supports, and enhances understanding and allows sustainability to emerge. So that's what we're going to tackle today. And let's get started by moving to your assessment and Section E. As I said, we're going to pull a couple of tools as we go through this assessment. I'll highlight those tools for you that you can actually use for communication sessions with your board. So this assessment tool not only meets a deliverable that you need for your network and the progress on your network, but it also is going to give you some possible tools to use with your board. And then, as I said, you'll be able to finish out the last of your assessment and hopefully look at who your stakeholders are and spend a little bit of time gathering great tools from one another in this afternoon session. So you've seen this as we move on to the third slide. You've seen this public agreement or board agreement, or in this case, it's our learning community agreement. And there's things like arrive on time, and without exception, this particular group, although some members have ebbed and flowed, you are just so punctual on the being on time. And my hunch is your board or your steering committee operates the same way. If we flip down some of these bullets and take a look at the next to the last bullet, this taking away one learning opportunity between meetings is such an important part of communication and of deepening understanding. And at the end of this session, we actually pose 2 or 3 questions that ask you to think about, so what new tool will you try out with your board, and what new communication approach will you ask your board to engage in? So as we go through the session today, if you'll be thinking about kind of what you want to experiment with over the next 30 days or so, keep that top of mind. You also, this next to the last bullet, you also want to encourage possibly your board members as part of their agreement for serving on the board or steering committee to communicate with one external entity between each meeting. That might be something that you track and report on, as well as who's attended meetings. So do they share information about what's going on in the network with their staff? Do they share it with state regulators? Do they share it with a hospital association or some statewide organization that could influence and assist your network? Those are things that really encourage sound communication and, again, build that understanding, which is something that you want as a result. So this tool of, how are we going to work together can be published on agendas that go out before every meeting. It can hang on the wall, and it's just a reminder this is how we're going to communicate with one another and work together. So there's tool number 1. You've seen it before, and this is how it's used in supporting communication. Let's move on to Section E, as I said, of the self-assessment tool. Here's a reminder that the communication is so essential, again, because you're bringing together diverse perspectives. So some, as we'll talk about later on, some of your board members are auditory learners, just as some of you around this table are. Some of you and some of your board members are visual learners. That's why we combine the PowerPoints and the assessment tool and the conversation on Adobe as ways of encountering and encouraging all learning to kind of converge and deepen the understanding. And again, some of your board members may be competitors, So the wisdom that appeared early on when you defined communication of being clear and transparent really becomes critical. And these are probably ground rules that you have talked about or will talk about as your sustainability plan continues to unfold for your network. So let's move along and say, well, here's the first requirement for network. What's your vision? And if you'll go ahead and answer that, and while you're doing that, if some of you will type your vision into the chat box, that will be great. We'll begin to see what visions are around the nation. It's always great fun to see how wonderfully unique each network is when we begin to see these visions unfold. Great, and here's where some of you, and thank you for putting into not only what the vision of your network is, but kind of where you've landed on the vision. Most of you are the getting there or defined. So you can begin to see that the vision work, kind of what you're hoping to attain through this collection of individuals willing to contribute their time. You can begin to see how communication, as you continue to talk about the vision, will deepen. Great. Thank you for jumping in on that. And let me just pause here a moment. And for those of you who have it defined, Gail, for example, would you mind, or Dee Dee, Suzanne, typing in kind of what your vision is, just so we actually see three of the visions? I'm going to test your memory here a little bit. It's not unusual, by the way, while we're getting some of these visions, I hope actually a vision or two defined here. And you can just put bullets if that works. You know, our vision is healthcare, our vision is connectivity through technology. You can begin to see that if you're a relatively new network, that being on a continuum of just an outline or getting there, or a little more granular. Some have a definition of the vision. All those are fine. Just keep it on your radar screen. And I think we've got some visions emerging here. We'll see what they are as soon as they land. And thank you again, all of you, for multitasking here a bit. Not only filling out the survey, but putting in kind of the vision of your unique network. Wonderful. I'm going to read again some of these out just for those of you listening in. Advocating tomorrow's healthcare today. Doesn't that allow you to really have a sense that this particular network is really looking out on the planning horizon and then rolling up their sleeves and talking about what can be accomplished today? Great. Optimal access. Can you see how every word in a vision, as you're working, and I can't remember, Gail, if you're an outline or defined, but these are wonderful words to challenge your sustainability and communication around what does optimal access look like. This is a great vision to hold. And collaboration to create cost and operational efficiencies. Perfect. So the calling forth, here's a board that's really vested in this whole, let's confirm that the way we're going to create cost and operational efficiencies is through collaboration. Perfect. Thank you for that. We'll keep pulling some of these, and let's take a look at rural Wisconsin. And I think we've got two of you in here from the state of Wisconsin, so perhaps this will resonate with you. This is one of the oldest networks that we have in the United States, and their vision is communities that will be the healthiest in America. So measuring that and looking at how they track that in each board meeting and over time is really fascinating to kind of take a look at. You can feel free to tag into that as you have time and energy to look at that. But let's move along and think about what happens in 2016, April 23rd, 2016. And a year's not that far away. And even if you're new to creating your network, the time tends to go pretty quickly when you're doing work of creating conversations and relationships between diverse members of a board. When you're 1 year old, what accomplishment are you most confident will be carried out? So just one quick statement there. What one accomplishment? And then 14B is what one goal is most at risk. In communication, really healthy communication, you have this coin that's always talked about, and it's great and it's sound and it's wise, particularly for open communication, to be talking about what you can accomplish and what your risks are. And later on in our discussion, we'll talk about contingency planning as part of the communication rigor that you each need in your network. And so let me just pause here. Could one or two of you put in what one accomplishment are you looking forward to being able to communicate about April 23rd, 2016? One accomplishment. I see Dee Dee is adding to our benchmarking here. So it'll be interesting to see what one accomplishment. Several others of you, please feel free to put in. This is where you get to do some visioning in the communication with your colleagues. What one accomplishment do you think will come from your network? No one's going to hold you to this, so this is always the fun part of the communication when you're among colleagues like this. We'll go ahead while Dee Dee and Suzanne are putting that in, and flip to question 15. You can go ahead and look at the primary function or your value proposition and where you are with that. Great. So here is one of the, and this ties, the reason I wanted this accomplishment to be tucked into this section of our conversation together today is it ties so nicely to the value proposition question on question 15. And regardless of whether you've barely started talking about what you want to offer to your key stakeholders or what your value proposition is, or if you're fully there, it's a great time and a wonderfully rich conversation in your board meetings and with your staff or with key stakeholders to be talking about this particular question. What's the primary function of the network? So Dee Dee has shared with us that member cost reductions for high key expense areas. So this is a great model for shared services, laundry, recruitment, credentialing, and you can see in the strategy that Dee Dee's network has that these are elements that competitors can easily land on and collaborate around. So some really, really value-packed assessment here, Dee Dee. Well done. Networking with others in the community, perfect. That builds Suzanne, Suzanne, I apologize, I've got a wonderful colleague whose name is Suzanne, and I don't know if you go by Suzanne or Suzanne, but in any case, thank you for contributing benchmarking ideas here. Networking with others in the community. That is such critical work when you're particularly starting a network. We get so focused on the tasks that we have to do, and yes, they're so essential, but you need to be inviting the external world in, and your board members need to be communicating and inviting the external world in. So those are great highlights. Let's move to the second part of question 15, and I apologize for moving you along quickly, but I want to allow you to finish this assessment, at least the first cut. And if you think about the primary function or purpose of your network, often this is called your brand statement. So if you're at the grocery store between fresh kale from the garden, for some of us in the United States, and tulips, what would you tell someone that is the key deliverable or the key purpose for your network being in existence? And it can be one or two sentences or 3 or 4, but what's the primary function for you being in operation? I always think of this as the kale description. And I see multiple people are typing. Great. Thank you all. This is you can begin to see how many different directions a network can go. This is excellent. Please don't stop. Okay. Wonderful. So here is a great statement that could easily be shared between tulips and kale. And here it is: to bring all healthcare organizations in our county together to work for a common cause, work for the common cause. So can you see that someone could easily understand, it's just our county, got that. It's all organizations, so whoever Suzanne is talking to would say, I'm a member, I have a healthcare-focused organization, I want to be a part of this. And bringing them together, it's almost a relief to be able to be in conversations with others who are trying to deliver health care when funds are getting eroded a bit or a lot. So that's a really compelling brand or function statement. And here's another one. We're alleviating health inequalities piece by piece. So when I hear that, I don't feel overwhelmed because we all know what the inequalities might be in our particular community, but there's some grace in this brand statement. It's piece by piece, so I don't have to feel overwhelmed. And the third one is decreasing unnecessary duplication of services and enhance access to affordable health care. Beautiful. You can see that in the decreasing duplication, there is room for innovation, creativity, and cost savings that can be applied to other services. Great, thank you all. These are very creative and could easily be understood, and people could jump on board and be a key stakeholder with you. So let's move on to question 16, and this is around the mission of your network, and is the mission defined? And go ahead and check off one of those boxes. And then you can move to question 17, and on your assessment, describe your network mission. And if we keep the momentum going, please go ahead and type in the chat box the mission statement, even if it's just barely emergent. Go ahead and type it in. And if it's fully landed, go for it. You're giving your colleagues some depth and breadth of communication that they may not have thought of, and so the chat box becomes such a gift. Briefly describe your network mission. We won't spend a lot of time on defining vision, which allows you to kind of look out on the horizon, or mission, which allows you to think about what contributions everyone can make. But those are really important: vision, mission, and the third element that we don't ask about on the self-assessment, but you may be developing through how you work together, are the values that your network holds. So here's a mission statement that we'll just read in so everyone has a chance to hear it if you happen to be an auditory learner. And there's nothing better than to hear a mission of a network because it kind of compels and gives us all hope. Our mission is to create a network that will strengthen the healthcare system across the county by decreasing disparities and addressing access to care with a holistic approach. You can see where this mission could last and hold the interest and creativity of multiple stakeholders for years. So thank you for sharing that. That's one that could engage and excite members of a community or a county. And I see a couple of others, and I don't want to cut off our communication with one another, because although the assessment is important, the sharing and the giving one another ideas is just as important. So look at this beautiful image that emerges when we think about Gail's mission from her network, and that's to be a bridge. So it implies this wonderful connectivity, a bridge to improve and sustain the health and safety of rural Marathon County community members. Beautiful. And then Suzanne's Actually, thank you, Suzanne. I was going to read yours, but she's leaving and we'll listen later, so thank you for being a part of our conversation today. So those are two great missions that you can live into, and I don't know if you've checked the box fully, but those appear to be fully developed missions in my mind. And as you'll hear later on in our conversation, making sure that they appear on your agendas on a regular basis or on any minutes that go out continue to be a form of communication that reinforces mission and vision as you go forward. So here's just another example of a mission statement from the Greater Delta Alliance, and that's all around creating and implementing sustainable community solutions to improve rural healthcare infrastructure by improving access to healthcare services, improving health information technology, promoting healthy lifestyles, and reducing healthcare costs through advocacy. So you can see that this is a network that's probably been around for a while, has a very robust membership, and is really looking at least 4 different business lines in their mission. Great. And all of you can take a look at the North Louisiana Chronic Disease Network mission. It's to expand and improve access to quality health care and wellness. And I'll allow you to unfold that. And thank you for putting that on there. What I like about this one as well, Sarah and Dietrich, is that you have identified your service area in this. And so anywhere where we have a mission and we're creating a container for getting work done, however we can create sound boundaries that aren't cement but porous but yet still sound, is a really effective way to build communication, participation, and deepen knowledge. So well done on that. And that's the first one I've seen today, by the way, on chronic disease. So looking forward to what your network produces here. Great. So let's move on, and this is the first, as promised, of the tools that you can use not only for completing this assessment, but that you might want to consider using as a communication tool in your board meetings or your steering committee meetings. And this tool allows you to talk about communities and ties right back here to the chronic disease network mission that's serving Cato, DeSoto, Webster as 3 of the counties that I'll just pick out since we have 3 blocks here. If those are the communities being served, what benefit would you see provided by the network to these communities and from these communities to the network? You'll hear just through our short time together today that communication, benefit, and value comes not only from the network, but also, of course, from those that you're serving. So it's a very reciprocal. Communication reciprocates and deepens as we give and take. And then this allows you and or your board to say, what's the success of that reciprocity, the benefit going from us to them and from them to us? So just take a moment and complete that. And you can circle back, of course, to this assessment, and if you have more counties or more communities that you're serving, add on to those. It's a good idea, by the way, to do this yourself at least once a quarter, and it's helpful, as I said, to engage your board in looking at this, and it's a great quarterly tool that can be used perhaps by a subcommittee and then report the findings into the greater board. So let's take a look at the network, the 4th communication requirement, and who are your markets. In a way, this ties to your communities, but if you're looking at shared services like laundry and recruitment, those are really very tangible product lines that will net you some financial return. And so you're going to want to know, have you fully identified or barely begun the work of identifying who might buy these services? So just go ahead and check on question 19. And you might want to fill this out if you have a number of service lines that you're considering. There's probably a difference for how far along you are in recruitment versus how far along, for example, you might be on laundry services or chronic disease reduction. And so feel free on question 19 to duplicate it for each one of the business lines you're considering if you have more than one. As we move to the second part of 19, this allows you to get a little more granular. And again, if we go back to the recruitment, there's so many levels that you could be recruiting for, and I'm just going to put some out there, and they may or may not be what your target market is. But if you're recruiting for physicians, will you be recruiting for physicians or PAs for all the hospitals in the county? When will you start the process is the third column. And what might be their engagement in purchasing recruitment services from you? So it gives you kind of a quick way to do a SWOT analysis, strength, weakness, opportunities, and threats for a business line you're thinking about. And that's, again, either a tool that you could use for yourself to certainly finish this assessment, but this becomes a great tool to use in your board as you think about a new market tool, a new service in your marketplace, or it also gives you, if you continue quarter by quarter to see that there's little engagement here, we're often a little reluctant to cut things off, but because we also need to be efficient both in what you do and how you communicate, this particular tool in the second part of question 19 can give you some insight in sometimes when you'll back away and put something on a back burner for a while. So let's move on to question 20. And this allows you to kind of check off what the awareness level. Is your network aware of communication and marketing channels that will be utilized to move products and services out into the communities? One of the reasons why this is so important, and some of you in the early first survey checked this, why this is so important is that you really are depending on your board members not only to purchase services or to fully engage in assisting with the services, but to also be a part of sharing that these services are available to their constituent base. And so communication, if you think of it in terms of rippling out, it starts at board meetings. Then as the minutes go out, your board members can use this to communicate to their staff and to their boards. And hopefully then the staff are able to communicate to their colleagues throughout the industry. If it's pharmacists, for example, and you're looking at reducing chronic care issues, they're able to say, well, here's what our network is doing. Physicians the same way. So there's a ripple effect that takes place when, depending on where you are in question 20. And then what methods will you utilize? Just quickly jot down an idea or two. And I'm going to pause here and say, am I going too quickly? Yes or no? If you want to, in the chat box, just kind of say speed is okay, or slow down, or we're doing okay. I'm clearly a visual learner, so I need to, okay, great, okay, perfect. I can't see faces, so I need to do a quick check-in with you. Perfect, thank you all for that temperature check. So we'll move on then to the next kind of sample of market tracking, and this again comes from a mature network that has a number of very vital service lines or products that they offer their hospitals. In this particular report, I think, although it's dated 2012, it's from the NCHN Resource Data Bank. And it gives you a sample of how you can use a tool to report out progress in your board meetings. So this is a particularly detailed one, and it actually even gives the financial implications here because they have the return on investment noted on this. You'll also in a moment see a more a quicker example that allows you to color code kind of we're in good shape, so we're green. We're, we need to think about our contingency planning as we talked a minute ago. We've got some risk going on, so we might be red, but there's all sorts of reports that your board might find helpful. And so let's pause here just a second and think about your board or your steering committee. And as you think about them, what percentage of your board or your steering committee are visual learners? Go ahead and jot them down in the chat box if you would. As you think about your board, what percentage of them are probably visual learners? Kind of fun to step back and think about that, isn't it? We often don't give ourselves an opportunity to do that. So as you think about your board members, and many of you have between 5 and 12 board members, what percentage of them are visual learners? This becomes important for communication. Nice, Gail. That's a very powerful assessment. Don't know, but I'm trying to incorporate all these strategies. Perfect. When you don't know, addressing visual learners and auditory learners, very important. Dee Dee, it's interesting, as we've been conducting this question in 2 earlier sessions, most are landing where you have it. 75% of their board members are visual learners. So this document, this market tracking, and agendas that go out usually a week early, minutes that go out and are usually out within a week after a board meeting, those kind of visual documents really begin to facilitate communication. So it's an opportunity to check in with your board members and see what works for them, keeping, as Gail says, an eye on that. So then let's switch a little bit to this whole area of retention. And often this question surprises people when a network is just starting out and you're getting your sea legs and defining things like mission and vision. But if you think back again to the early survey, what's so important is building trust. And that's a key reason for retention. If you do have a group of competitors who are really moving into collaboration on behalf of their service area, retaining people and building trust over time is just critical. So take a quick look at this question 22 and mark what's appropriate right now for your network. And then we'll move to the second part of this question. And this is where we've gotten some really rich ideas from some of the earlier sessions again. As you think about your network, do you have any retention plans that you've put in place or your board has put in place? And if so, could you just quickly note them in the chat box? What are some board retention strategies that you've thought about? And you could literally not have them in place yet, but they're kind of cooking at the back of your mind. So what is a retention? And often retention has to do with, is tied so closely to communication, and it's also tied so tightly to celebration. So as you think about where you are in the development of your particular network, it might be time for a brief pause and a reflection of what has been accomplished. And often that is a key, strangely enough, but true enough, a key retention tool. Any other retention tools? I know you're so early in the game, it's almost not fair to ask this, but just it's not too early to be jotting down ideas for retaining your members. And as I said, we could also flip this question and say, how are they retaining you? But this particular question is all centered on your board, and you might find it interesting to pose this to them at a board meeting. So 1 or 2 items that you would pose there. And retention, it's interesting, Dee Dee, you've said that it's in your operating agreements and bylaws. Well done. And my hunch is, and again I don't know, is that often networks create a minimum level of meetings that you must attend as a way to retain and build trust, so that in a year you need to attend at least 75% of the meetings in person. Because there's something about face-to-face contact that builds rapport and allows conversations to deepen and understanding to grow. Although we don't have a chance to peek into Dee Dee's bylaws or operating agreements, you can see that they've been doing some pre-thinking about how important trust is to build through a retention plan. Well done. Great. So let's move on to the board and the first year goals. Please take a look at that question and go ahead and check it off. And we'll move on to question 24. So let's talk about financial projections for your network, and it ties directly to your sustainability plan. And go ahead and answer that question. And while you're answering it, if you'll put a note in the chat box of how you've answered this question. Have you barely begun to look at the financial projections, somewhat, generally, mostly, or fully? If you'll just go ahead and type your answer in the chat box. We want to talk about this a little bit because often panic grows when we talk about financial projections and sustainability. So as you check this off on question 24, if you'll just go ahead and thank you for your willingness to participate, by the way. It makes it, we get a good view of what's happening across the United States. So anybody courageous enough to say, here's where we are on our financial projections? While we're pulling some answers from that, let me just kind of unpack this question a little bit. The first year financial projections, and thank you, we have one courageous leader saying not there yet. And I would say perfect, because the financial projections are tied so closely to who are your key stakeholders. What service lines make sense to offer at what time period? Do you have the right and all of the right board members or steering committee members in the room? So this whole question of financial projections is almost a hub and spoke question. The financial projections may be the hub, but the spoke that emanates out from this wheel are all those other elements that you must have to have a stable wheel. You have to know your stakeholders. You have to know the counties that you're going to serve. You have to know what your metrics are. And so it sounds like some of you are really doing that thoughtful work that will get you here just in time. Let's see. Thank you, Gail, for your note as well. What I like about the response that Gail has posted here is that it reminds us that these are projections. And so as you begin to understand the issues more fully and as your board begins to delve into what needs to be done, these projections are subject to change and pivots are very possible, and that comes out of really great communication. And so let's go ahead and look. As I said, here's an sample of how you could begin to give feedback to your board on where you are with financial projections or board participation. You could continue to look at this graphic and highlight we're thriving because we have financial projections and 100% of our board members are purchasing our services. So on the far right, the thriving sign could appear in green. If you were in the middle with only 2 to 3 board members purchasing a service and or attending a meeting, for example, on a regular basis, that becomes a red. So using yellow, red, or green on this continuum of how participation or financial landing is a way to have another market tool. Here we are for contingency planning. So if in question 25, if you'll take a look at that question and say, do we have one, yes or no? And then swing to the bottom of the second part of that question. And for contingency planning, do you have an item that you're thinking about? And sometimes it has to do with numbers of people who will purchase a service like recruitment. And by what date will you make an assessment of this is a go, no-go? That's what the contingency planning has to do. And sometimes these elements of contingency planning, you think, oh gosh, haven't even really landed on the mission and vision. So these are thoughts to say, where are you right now? Might want to come back to this in 2 months or 3 months. But contingency planning for sustainability becomes critical. Great. I'm going to move us along then. Your board members, if they haven't bumped yet or had a disagreement, they're probably not yet touching the ability they have to be wildly innovative and creative. So here is a question about conflict resolution and where are you? And some of you may have this built into your bylaws or your operating procedures. And conflict resolution or decision making, both terms could be used. And let me share with you how this comes into play. If you're considering a new business line and you really, for your financial projections, need 100% participation, how will you land on getting everyone to participate? That becomes the question around strong conflict resolution or decision making. So go ahead and check that, and then we'll move on to the next question, which shows you that you might want to build for decision making a continuum. There are some decisions that your board or your network will make that need a majority vote only. Yep, directionally, we're correct to include these 5 counties. Or it may be that the decision about which counties will be served first through laundry services or through chronic disease prevention and identification, your board, all members of your board need to land on a yes, we're going to serve these 2 counties first, and these 3 counties second after we've learned something. That may be an all or nothing. So for every proposal you potentially have for your board or steering committee to decide what is the decision-making outcome that you're looking for on the continuum is an important part of your consideration for communication. What you don't want to have happen, and what often can happen, and don't worry, you can recoup from it, is that you need to have a decision, but you're not sure how many people need to weigh in on the decision. And if you don't know how people prefer to learn and absorb information, you might be giving a written report, and what your board really needs is a lot of time for dialogue. So just check in with them on what they need for making decisions and how they want to make decisions. And we could spend a whole hour on that outside of this, but just here's a continuum to keep in mind. So before we pause and go over a summary of what's emerged here, I would like to have, if you would, and this ties to, as Leslie promised to do, a takeaway for the end of this meeting. What 1 or 2 great communication tools do you have within your network that you think really deserve to be noticed and celebrated? So if you'll just put those in the chat box, what 1 or 2 great communication tools have you landed on and created or leveraged? If you'll just go ahead and tuck those in the box. And by the way, you should be almost done with your assessment tool. So if you don't mind to just in the chat box, think about, is it the fact that you really have spent time on the vision and mission statement for 2 or 3 meetings that is an excellent example of communication. You've gotten everyone involved. You're kind of throwing out possibilities. And so what are some great communication tools? And Leslie, I hope you're putting in your powerful link there because she's got a great tool. Perfect. This is another example of a tool that you can, a communication tool that's so important, and you can update it every board meeting, and it's a living document. Others of you. The fact that you've got operating agreements, Dee Dee, I would say that's a really key communication tool, and one I don't usually see for networks that are fairly new, so well done. And those of you that were able to check the box on mission and vision and that you're in conversation about those, well done. Those are also key communication tools if you're not giving yourself credit for that. Perfect. So Dee Dee's kind of projecting ahead and looking at that in addition to the operating agreement, kind of creating reports around that. The balanced scorecard will be perfect for that. I'm just, if you don't feel you have any key communication tools, and my hunch is if we were in conversation face-to-face, in about 2 seconds, we'd have some great communication tools that would pour out of all of you. You each have them. You probably just haven't given yourself credit or celebrated them enough. Let's do a quick summary of some key communication takeaways from today. That there's some tools like the balanced scorecard or like the market participation that members would like to hear about, and if you do those in every meeting, you'll have a chance to note progress. So some of those tools that are actually in the survey can be used as communication tools. Don't forget that even though you're living in the network mission and vision, that often your key stakeholders are only living in the mission and vision when they get the agenda or when they come to a meeting. So don't hesitate to reinforce some key communication concepts or needs 12 to 16 times. Make sure that you're giving time for conversation, as well as sending out written documents in advance, and my sense is all of you both know and are doing that. You might want to send out what has worked in a board meeting and what would you change, just as a quick, this is working and this is what we change, once a quarter, and see how that, what feedback you get back from your board. And I can't stress enough that metrics and reporting on those are just an important way to make sure that you've got traction and that you're building in sustainability practices for your network. So I want to just stop and thank you for your full participation. As I know it's late in the day, but thank you so much for spending time with us for the 4 sessions and for completing the assessment. And we hope that in the communication in particular, you realize it's a living, breathing entity, and the deep listening, the transparency, the openness to new ideas and different perspectives really allows you to build the trust that's necessary for these remarkable organizational entities doing amazing work in communities across the United States. So thank you. And Leslie, let me turn it back to you.
And thank you, Mary Kay. You had 4 very well thought out presentations for the network planning directors as well as the self-assessment tool. So just a reminder for the networks, that self-assessment tool will fulfill your deliverable that's due at the end of your grant period. So one recommendation would be to pull it out again towards the end of your grant period in July or August and go through some of those questions that you didn't make progress on. You might not have made progress on yet, but I'm sure you will at that time. So all the webinar recordings, again, are posted on our website, and I'll put that link in the chat box so that you can refer back to those later on in your grant period. The next upcoming technical assistance activity is planning peer group calls, and the next call will be on Thursday, May 7th, and we have 3 calls around 3 different topic areas. The first is population health, and then health information technology, and clinical care and chronic disease management. So if you haven't already, there's a link to RSVP for the upcoming peer group calls, and those will be just for network planning grantees. And also we have 4 poll questions up on the screen right now. One is your overall satisfaction with today's webinar. And then the other 3 questions are short answer questions about takeaways from today's webinar. What is one additional communication report that you would recommend to your board or steering committee? The one additional retention action you would recommend to your board or steering committee? And the one additional community or community participant that you will recommend to your board or steering committee? So if you could, I'll leave the screen up so you guys can take a minute to think about